That black dot you spotted in the mirror this morning, is it quietly eating through your tooth? Or is it sitting there doing absolutely nothing? Most people guess wrong, so let's fix that right now. Is a black spot always a cavity? Not even close. Sometimes it's just bacteria sitting on the surface, doing zero damage underneath. Question 1. Why do kids get that dark line right along the gums? That's usually a completely different type of bacteria, one that actually shows up more in mouths with decent hygiene, not less. Question 2. Can you just brush a black stain away? Barely. It bonds to enamel the way coffee bonds to the inside of a mug, so normal brushing won't touch it. So if hygiene alone can't explain it, and it's not automatically decay, what's actually happening underneath that color? Let's break down the two completely different processes that can both turn a tooth black. The first is certain pigment-producing bacteria, often a species called actinomyces, sit in the biofilm layer and react with minerals in your saliva to form a dark deposit on top of the enamel, like rust forming on the surface of metal, without ever touching the metal itself. The second is biological damage. Acid-producing bacteria feed on sugar and slowly dissolve the mineral structure of the tooth. And if that process stays slow enough for long enough, especially in a pit or fissure or along a root surface, the lesion can actually remineralize and turn dark and rock hard instead of spreading, which is why dentists call it arrested. The only way to tell which one you're looking at is a dental probe to feel the texture and an X-ray to see what's happening below the surface, because your eyes alone can't make that call. Now, let's clear up what people get wrong constantly. Myth 1. Black always means a hole and a drill. False, because an arrested lesion can be completely stable and just monitored over time. Myth 2. It's a hygiene problem. Actually backwards, because that pigment-producing bacterial community tends to show up more in mouths that already have lower decay rates, since it's competing for space with the bacteria that actually cause cavities. Myth 3. Whitening toothpaste or strips will get rid of it. They won't, because whitening agents work on color trapped inside the tooth structure, not on a bacterial film sitting on top of it. That needs mechanical removal, not bleach. Here's how that plays out with two real situations. A young patient comes in with a dark line, tracing evenly along the inside of the lower front teeth. Parents are convinced it's decay. On exam, it's hard, smooth, follows the gum line perfectly, and the X-ray shows nothing underneath, so it's the pigment type, and a hygienist removes it in one visit using a slow-speed polishing cup with a gritty paste, buffing the deposit off the enamel surface. But because the bacteria causing it live in that child's specific oral environment, it can quietly return over the following months. So the plan isn't to panic every time it shows up, it's to keep checking at the regular cleaning. Compare that to an adult patient with a single dark pinpoint deep in a molar groove. Hard on probing, but the X-ray shows a shadow extending down into the dentin underneath, meaning the surface looks calm, while damage is already spreading beneath it. Left alone, that acid keeps tunneling under the intact enamel layer, completely invisible from outside, until it eventually reaches the nerve, and what could have been a simple, conservative filling turns into a root canal and a crown, a far more involved procedure for the same tooth. Caught at that stage, the options are usually either a protective sealant flowed over the area to stop it from progressing further, or, if it's already gone deeper, removing just the softened tissue and replacing it with a tooth-colored filling. Both dramatically more conservative than what's needed once a lesion reaches the nerve. So here's what's actually worth doing. First, don't try to diagnose this yourself in the mirror. A probe and an X-ray see what your eyes physically cannot, so get any black spot or line checked rather than guessing. Second, if it turns out to be a surface stain, ask specifically about a professional polish rather than reaching for whitening products, because those won't touch it. Third, if it's flagged as active decay, deal with it while it's small, since the conservative options shrink the longer it's left. And only your own dentist can tell you which path actually fits your tooth. So that's the conversation to have at your next visit. Bottom line, black doesn't tell you what's wrong, it only tells you where to look. Your dentist is the one who turns that color into an actual diagnosis. Book a checkup, get it properly identified, and if this changed how you'll look at your own smile, follow Tooth Truth for more breakdowns like this one.